Hi, this is the intro for Case Concept for Fall 2012. I'm Dr. Jackie Gattis. Hopefully you are in the right place. If you're watching this video, I'm glad you've found your way to this introduction. I apologize for not being able to be at Case in person for the first day. I assumed wrongly that grad psych followed Vanguard's undergrad academic calendar. I assumed the whole campus followed the same academic calendar, which undergrad starts Wednesday the 22nd. So I didn't think I needed to be available for class on August 20th. Lo and behold, I did, and I am actually going to be on my anniversary vacation that weekend. So I apologize for not being there in person, but I'm glad for our electronic culture that I can actually be the one to kind of introduce you to Case, give you a chance to kind of get a sense of who I am before we dive into the material. Okay. So, but that is why I'm doing this video. I didn't want to go ahead and just have an email conversation back and forth when you don't know who I am as an adjunct prof. You've had no exposure to me whatsoever. And then to just, email back and forth and say, okay, who wants to go first? All right, you don't know me, I'll see you next week, and we're going to go ahead and dive into your clinical material, and you're going to show me a case, and I'm going to go ahead and give you feedback. That's not how I wanted to start. And yeah, so my thought about the video is that while I miss out on getting a little bit of a sense of you guys, and really having a back and forth of kind of developing the foundation that we'll move from, at the very least you can get a sense of me and who you're going to be working with this semester in Case before you go ahead and start presenting your clinical material. So, in terms of me, again, my name is Jackie Gattis. I am a clinical psychologist, graduated from Rosemead School of Psychology in 2006. I don't know how much of my professional stuff you want to know, but I did my internship in Long Island, New York, at a college counseling center at Stony Brook University, and it's a very multicultural campus. It was a fabulous experience, very psychodynamic. Rosemead, I imagine you know from Jerry, at the very least, has a very psychodynamic object relational foundation. So that's definitely the modality that I use, and I'll talk a little bit more about that. You'll see that, and it's just who I am. So you'll feel that from me. So after that, I returned to California. I worked at a facility called Center for Discovery and Adolescent Change. It was a residential center for teenagers with eating disorders. So residential care, the kids are so into their eating disorders, they're being pulled out of their families, pulled out of school. Either their behavior was just too out of control, or physically they were declining. That they couldn't be trusted to care for themselves any longer. So I was a therapist there for 2.5 years, and I think I directed the facility for 1.5 years. And then I left that job because I had my son. And I just did not feel like I could manage the severity of that client population, the families, the symptomatology, the crises, while being mom. So I left that job in 2010, and since then I have been in private practice in Costa Mesa, seeing clients as well as being adjunct there at Vanguard. And now I'm teaching undergrad also at Vanguard, and I also supervise training therapists back up at Rosemead. So those are the various hats that I wear in my experience. I would say my specialties are eating disorders, psychoanalytically informed psychodynamic therapy, and working with people of faith. Those are my specialties. So a little proviso, you will see that everything that I do, the way I think, just is foundationally psychodynamic. That doesn't mean in this class that you need to feel any pressure to present from that modality, whether you've had the class or not. If you want to, great. I also know that that is something that's valued here at Vanguard. But you don't need to feel pressured to do that at all. I have experience with CBT and DBT. Working in residential, I've done a lot of active interventions with teenagers and with younger children. I've done art therapy, I've done family therapy. So I've worn all those hats. They're not as intuitive, intuitive, spontaneous for me, as thinking and moving psychodynamically. I don't feel like I have as full of a range to work in that way. I feel much more narrow in that range in those other modalities than I do in psychodynamic, but I can use it. So do what you know and what makes you feel comfortable, or don't do what makes you feel comfortable if part of what you want to do is learn and stretch in a different direction. So whatever you feel like you need in terms of conceptualization is fine. And I say this every time I do case. I've gotten a better sense of, as Vanguard students, what you've been taught and what you haven't, how much practicum time you've had, and what, your program is just very different than Rosemead. So I don't get to know, I don't get to do case from the inside out. I don't get the privilege of being able to do case, knowing, kind of living and breathing this environment, knowing exactly kind of where you guys are at. So if I assume that you know something and you don't, if I'm using a word that doesn't make sense to you, or you don't have context for, you don't have as full of a context as you'd like, please stop me. Please ask questions. Experience myself as open to feedback and, excuse me. And I really want to be able to meet you guys where you're at. But sometimes I will admit I need your help as a course adjustment. I really do want to meet you guys where you're at, but I still am a bit, maybe in some moments a big bit, coming in from a different therapeutic culture. It does feel a little bit like if you've ever had a cross-cultural experience and kind of having to get your bearings, it can feel that way a little bit to me, because there's a lot at Vanguard that's similar to Rosemead, but then all of a sudden there'll be these pieces that aren't. So I can kind of start to assume, oh yeah, you know this, or you do things this way, because that's how we did it, and it feels similar, and oops, no you don't. So I need your course corrections, excuse me. So I invite that. Please don't feel shy or just stay frustrated if I'm not getting you or getting where you're at. Please speak up. Whether that's in class or emailing me afterwards or stopping me in the hallway afterwards, whatever. I'm good. I'm really good in either of those ways. Okay. At this point, if I had you in person, what I would do is I'd really want to know more about you. I'd want to know about in addition to your names, a little bit about the practicum site that you're in, how many semesters of practicum you've been in, what therapy classes you've had, and I'd want to know what you feel like is your growing edge right now. Like what do you feel like you need to work on as a therapist, or what are you getting feedback on that you need to work on as a therapist, which is just the process of being in therapy school, isn't it? It's just constant feedback. So these are the things that I'd want to have a conversation with you all about right now that I am missing out on. But I'm going to ask that you email me answers to these questions. And so the email that is preferred for me is Jackie, Jackie, at drgattis.com. So drgattis.com. So Jackie at drgattis.com. You can use my Vanguard. I'll spell that out here too. I didn't put it on the. It's a set syllabus that we're given for case. I probably could just go ahead and type all this information in here in the future, but I didn't this semester, so I'm sorry for that. But my Vanguard is Jacqueline, JACQUELINE .Gattis, GATTIS at Vanguard.edu. I checked my Vanguard email, but I am slower in responding to that one because my drgattis.com is connected to my phone. So when I'm home with my son, in between clients, I quickly scroll through my phone and see what I've got. And if something's short, I can shoot an email off really fast, no problem. I have to be at a screen, at a computer to deal with the Vanguard EDU, and so that just means I generally don't get to it till the end of the night. So I will get back to you faster if you need me at my Jackie at drgattis.com. Okay, so the questions again that if you could send me would be what practicum site are you at? Not just the name, but a description. I'm not always familiar with the places you guys are at. So description meaning kind of what kind of population are you serving, what kind of work do you do? How many sessions do you generally get to have, stuff like that. How many semesters of practicum have you had? What therapy classes have you had? So if you had PSYG716, have you had CBT, that sort of thing. And then lastly, what do you feel like is your growing edge? / what are you getting feedback on? What do you know you need to work on? We all have those places. Okay, so if you could just give me that information, that helps tune me in to what we need to focus on for this semester. Okay. If you don't have a printed version of the syllabus at this point, I would suggest pausing the video or going to print it now. I think it would be helpful to look at the syllabus as I talk about it. If you've done case before, you know, a lot of it is the same. They have changed a few things. So I want you to, I'm not going to go over all of it, I'm going to go over the finer points. What I think is important, and then the changes. Okay, so the biggest issue, I think one of the big things to know on your end is whether you're taking PSYG716 or PYPD0708. For those of you who are in 726, you're taking this class for a grade. Those of you who are in 708, it's just pass-fail. Okay, so where the rubber meets the road, where that matters, is generally points. Okay, and in how prepared you want your materials to be, the points that you want to get, and generally attendance. Okay, you are allowed to miss 2 classes without failing this class and having to repeat it. You can't graduate without having a certain number of cases completed. I know you know that. So So you can only miss 2 classes and still pass. So what that means is that most students miss 2 classes, which is fine. But for those of you who are taking it for grade, you lose 5 points. Everybody loses 5 points each time you don't attend. But if it's pass-fail, it doesn't matter. It's as long as you pass, it's fine. For those of you who take it for grade, if you miss two class periods, what that means is the highest grade you can get is an A-. It's a 90%. Then minus the points that you miss on your assignments. So you quickly gravitate down to a B something. So that's just important to keep in mind depending on how important a grade is to you. Or how important, what level of a grade is to you. Okay. I'll let you read the course objectives. I imagine you know this, but I'll go over it just in case you don't. Excuse me, that's a lot of words to say. The point of this course is to give you more practice presenting clinical material professionally. So you will have 2 opportunities through the semester where you will be the sole person who presents clinical material. So that is the procedure of the course. And then there's an abbreviated presentation and an extended presentation format. And we'll go into that. Okay, let me see how I want to talk about this. Please look on page 2 of the syllabus for the practicum placement and the required forms that need to be turned into Lisa in order to pass this class. Okay, I have nothing to do with that, but in order for you to pass this class, you have to turn in all this. You have to be in practicum and you have to have the appropriate forms. So please just address that. Okay. All right, breaking this down. So the abbreviated case presentation. Okay, there will be an oral presentation, which I believe is 15 minutes, they suggest. Yes, 15 minutes. So there'll be an oral presentation in the abbreviated and the extended. I guess this will be the point at which I'll tell you then. Just remember that this is meant to be professional in nature, and you can see the grading rubric online on Moodle for CASE, what you're graded on, and professionalism, professional language, professional attire is all a part of it. You don't have to be dressed to the nines or anything, but to remember that while I am very casual in CASE, I'm very casual in supervision, you just kind of, who I am is what you get. And I will be casual with you on your presentation day. On your presentation day, you should be professional, okay? Because you're practicing professionalism, regardless of how casual the rest of us are, okay? Pretend you're a little bit on an interview. Or I'll have to give you feedback for that, or don't, but then I'll have to give you feedback for that. Okay, so both the abbreviated and the extended have an oral presentation, 15 minutes. It's meant to be professional. And then there's a summary of information that you're to present for your oral presentation written in the syllabus, course of treatment, history, diagnosis, questions, didactic, and spirituality. My notes to myself are under diagnosis. You're not just supposed to do the DSM, you're supposed to do the conceptual diagnosis orally. You're supposed to present from a modality, not just in your case formulation report, but also orally. You're supposed to present your case from a modality. And I feel like that's part of the growing edge of this case, especially the fall case, is that's what you're learning to do, is not just present material, historical material generally, and from a general understanding of psychology. You're working on working in a modality. I get that. I'm just using this time to remind you that's what you're working on, and to try, even if you feel like you don't know much, to, in your oral presentation, to do as much as you can to present from a modality. Okay. So oral presentation in both. You're doing a video for both. Please have your video queued up to what you want to present. A lot of students will ask me, well, what do you want to see? And I don't know what I want to see. I don't know your video. I don't know your client. I don't know what you guys have been doing. So it's not my time. It's your time. So it depends on what you want. Some students are ready to go ahead and show the hard part of their videos right away. Some people aren't ready. Maybe they will be for their second one. Kind of wherever you choose. It's fine. But I just ask that you come prepared with your video queued up to where you want it to be. And generally your transcript will jive with what you've shown. Okay. It may be shorter or longer depending on how much of your video we see, but they should add up. That's the difference. I'll go ahead and jump in. That's the difference for this case this semester, is that the transcript, the 10-minute verbatim transcript with the coding and the format is on Moodle, is required for both the abbreviated and the extended, and not just the extended anymore. So there's oral both, there's the video both, there's the transcript for both, and then there's the case formulation from a modality for both. The extended, then you also turn in a case report and a treatment plan. All the forms are on Moodle again. Okay. Let's see what other notes I have to myself. You may be aware of this. If not, this is an important point to me. Your grade in this class is not based on what you know. It's based on how well prepared you are. Okay? So I love how it's structured this way. So as long as you do your work and you come prepared, you all get A's, or you all pass. You did the work. My feedback about, the specifics or proficiency, all that, my feedback is based on where you're at, what you know, what you don't know, what you missed, confusion points. Those are my feedback is about skill level. Your grade is based on preparation. So that is built that way. The reason I love it is it's built that way so you don't have to feel anxious about bringing in your hardest cases or practicing presenting from a modality you don't know much about yet. Like that you're trying something on and seeing how it fits for you. You're not penalized for being in a learning. Alright, sorry, new day. My video cut off the last 2 minutes. So I think I was saying that, just that I like how case is set up so that you are graded on how well prepared you are, not based on what you know, so that you have, not based on your skill level, so that you have all the space to bring in difficult cases and to work with, trying a theoretical modality that you maybe don't have a lot of practice with, and your grade is based on just how well prepared you are, not on your level of knowledge. So you have all the room to play. I'm sorry about this. I think I've gone through the whole syllabus at this point, and I don't remember exactly. This was a couple days ago. I think what was left to talk about was to sign up dates for your presentations. Now, if I had you here in person, we would go ahead and do that. But since I don't, I haven't had the experience with Moodle yet, whether or not I can set up a forum to talk back and forth. What I need someone to do is email me at Jackie, Jackie, at Dr. Gattis, drgattis.com. So Jackie at drgattis.com, and let me know if one of you would volunteer to go ahead and go first on August 27th. Because I know some of you will just be starting practicum, some of you won't have seen clients in several months. But as long as, preferably, hopefully someone will have seen someone in the last month and they can just go ahead and volunteer to go first. We'll just kind of progress through the month with people who are seeing clients, and hopefully those who don't have clients yet can catch up. So along with the information that I asked you to email already, what therapy classes you've had, what practicum you're in, with a description of what it's like, and what you feel like your current growing edge is, or what you're getting feedback on that you need to work on as a therapist, or what you know you need to work on. If you're willing to go ahead and go first, go ahead and email me that, and then I will email you back and confirm who is going to go first. And then we'll hammer out the rest of these on the first day. And then we should have 2 extra meetings, provided that there are 6 of you enrolled in case. And Moodle still hasn't been updated, Moodle 2 for me, so I can't get in, so I can't see who's actually been enrolled. But if there's 6 of you, there should be 2 extra meetings, and my thought is, because you'll see in the syllabus, we can't just take those off anymore, we have to actually use those times. So my thought is that we would take a break halfway through and talk about general questions coming up, and then another week, the very last week. So my thought is 10:15 and 12:03, that we wouldn't have presentations, that we'd just have time for general questions. But if anybody has a strong preference on when we take those breaks, if you have something going on, or if you want to save them both up for the end of the semester, so one the week of Thanksgiving and then one the last week, email me that also. If someone has a strong preference, we'll probably just go that direction, because it doesn't matter to me either way, whatever works better for you. Okay, I think that was it. If I've missed anything, if you have questions, let me know on the first day that I'm physically there on 8/27, and we'll pick up there. All right, I look forward to meeting you all. Bye.